Hey, hello everybody, it is Dr. Steve Hoffman back with another episode of Core Wellness TV, and today we're going to give you a simple exercise, okay, to help you deal with low back pain that is non-disc related. This is going to be more for the people who have more pain when they lean back into it. If you can't lay on your belly and read a book kind of thing, if it hurts you to lay flat out on your back with your legs straight and it makes you feel like you're jamming up your low back, then this is for you. Potentially, okay? There's not one stretch for everybody every time, but I'm going to give you the most common one that helped a gentleman who came into my office today with very high acute low back pain, very antalgic gait, walking like an old man, okay? So what we did is we determined that he was overloading his facet joints in his low back, okay, and his erector muscles, these big muscles that go up and down the back, were actually in protective spasm. So he was kind of like this, and he couldn't release out of it because he was just spastic, right? And you don't have to walk around in spasm to have this problem. It could just be that ache. Your back just kind of aches, especially when you go on long walks or do stairs or things like that, and you get that ache. This is the move for you. Now, we call it the push away lunge in the fundamentals series. It's at gettoyourcore.com, and that's the fundamental series you can get there just by, it's on the home page, where you get nice and wide, and we lunge down and we push away back up. We're basically trying to open up the front of the hip. Now, what we did with this gentleman, let's give him a name. Let's call him John. All right, John came in, and what we did is, in addition to dropping in a slight drop. Now, it's important when you do this not to allow your back to load up, okay? Because for him, anytime he got into this position, his back started to go into spasm. So, this is one of those times when I said, yes, keep a very strong posterior pelvic tilt. Now, I don't always say that for everybody, but in this instance, that's what unloaded his facet joints in his low back. And we drop down a little bit, and that increases the stretch. And then we reach up and away. And not only does that get the muscle, the psoas muscle, which attaches and inserts into every single one of your lumbar spine vertebra and tends to draw it into extension, which causes those facet joints to jam up. It also opens up the whole fascial sling, all the way from the armpit, all the way down to the side, all the way down to the knee. And we reach up and away very gently. It's just like you laterally bend away. Let's do it from this way, and at the very end we turn back towards it ever so slightly, and that takes that psoas muscle and that whole sling of tissue and just opens it up and allows the tension that draws the psoas, or that draws the vertebra into extension, to relax, okay? And after he did this, okay, well, first what I did is I manually relaxed those muscles, okay, where he laid on his back, and I had him push up and hold for a few breaths, and then he'd release, and I'd take some of the slack out. Okay, the other leg was up here, right? If you in the fundamentals program, you'll see this as the hip flexion test, or the hip tightness test, or the modified Thomas test. It's one of the self-tests that you get when you get the fundamentals series. But I did that release, and just after that, took him from walking like this to walking upright. Do you see what I did there? I just took the tension out of the front system. This is where the crossed posture syndrome thing comes in, guys. Whenever your body's under stress or in pain, your body goes forward into protection mode. Okay? So you have to break that pattern. And then he was able to stand up straight, and the back pain was nearly gone. But after he did a few of these reach and turn exercises, he said, normal again. Okay, now this is coming in like an 8 or 9 out of 10 pain to a 0 to 3 pain in a matter of 10 minutes. Okay, and this is not just me doing something to him, this is me educating him on what to do after he leaves, because it doesn't matter what I do if he doesn't change the pattern when he leaves. This is going to come back and back over and over and over again. And this has been a recurring pattern for him. So, the main take-homes here. Try that move. If you're having low back pain that's kind of achy, that hurts especially when you go into extension or lay on your belly or lay on your back, try this. It may just take some of that tension out, okay? The other thing is, stress draws you into predictable patterns, right? Remember, this pattern is the same as what you'll see in a stroke patient, a cerebral palsy patient, a person who has had polio kind of twisted and in, right? This is the same thing that happens to everyone as stress accumulates over a lifetime. It doesn't have so much to do with age, it has to do with how much stress you've accumulated over your lifetime and how much you've addressed that. Okay? And that's what we do with the Core Wellness Institute. That's what I do with my Reverse CPS Now program, Reverse Cross Posture Syndrome. And it's a deep dive program on how to not only get rid of the tension in the front of your hips, the tension in the front of your shoulders, to make effortless posture happen and create efficient, strain-free movement so you don't keep overloading the tissues and making yourself age more quickly than you need to. Okay? When I say age, I mean biologically age. I don't mean chronologically age, because you can be 30 years old and have the body of a 60-year-old. You can be 80 years old and have the body of a 40-year-old. It just depends on how you pay your tissue debt along the way and how you address stresses. That's it. So keep opening up your hips, keep taking the load off, and keep thinking good thoughts, eating good food, and keep moving. Okay? See you later. Bye-bye.